Okay, so Charlie Kirk and Michael Knowles have accidentally stumbled onto something they were never supposed to figure out. These are paid actors, who are paid to peddle right-wing propaganda to youth who mistake their act for real political discourse. As such, they don't actually understand policy, or really why they're being paid to say the things they say. Here is Knowles acknowledging a potential precedent.
You know, what's so scary here for conservatives is the precedent. Because, listen, I'm fairly amenable to the bill. I can get behind a lot of aspects of it. But the sticking point for me...
You're more amenable than me, but finish.
I know, I'm probably more amenable to it than you are. But the sticking point for me is we are now setting the precedent of the government on a massive scale sending direct checks to people because of a time of crisis. Well, look, maybe this is a serious crisis, at least an economic one, but what about the next time?
The elites who fund their sources of income know that policies like Universal Basic Income and Medicare for All would work well and would be quite popular. What they don't want is their taxes, which are currently historically low, to go back to what they were during the New Deal decades, when America was apparently great, and before it was subjected to the trickle-down economics scam that resulted in all economic gains going to the top while middle and lower income earners saw their incomes fall behind rising costs of living. In fact, all of this talk about democratic socialism is nothing more than the continuation of the New Deal in other OECD nations, which progressives are looking to bring back to the United States. Nations that haven't gutted their middle and lower income earners for the sake of a small wealthy elite have continued along the path, which was actually set by the United States. For context, both Harry S. Truman and Richard Nixon were proponents of universal health care. Why? Because before Ronald Reagan, the GOP was a genuine political party and not merely an extension of wealthy individuals and corporations. Then Charlie Kirk stumbles onto the notion that we can, in fact, afford Medicare for all.
Yeah, but Michael, I mean, Medicare for all costs $32 trillion, but not $32 trillion a year.
That's right.
That number that Bernie said was over 10 years. So now we've set a precedent that $3 trillion a year for Medicare for all is not that much.
Yeah.
In fact, it's perfectly affordable. But UBI, why not do it every quarter? Why not every month?
Why not?
Well, kudos to Charlie for this admission, but he left one thing out. Medicare for all may cost $32 trillion over 10 years, but our current healthcare system will cost $36 trillion over the same time period. So yes, not only can we afford it, but it's also more affordable than our current healthcare system, and it would cover all Americans. Not only are medical bills the #1 cause of bankruptcy, but tens of thousands of people die every year due to a lack of adequate healthcare coverage. This is the reality behind the GOP's meaningless platitudes. Freedom and choice to them mean the freedom to choose between bankruptcy and death, for many Americans.